Welcome everybody to Soul Talk Season 2. Hello Mimansa, how are you?
All well, thank you so much. Pleasure
So
to
we
be
have, I'm so sorry. So we have Mimansa today, head of Fortis School Mental Health Program. She's also an author, mentor, and definitely parent. So we will be doing a lot of conversation with her today related to school and the children parents relationship and conversation on that. So, Mimansa, let us know some of the successful initiatives which you are part of and how it is actually significantly impacting the school programs.
our school program is something which we've been doing for more than a decade now. I think it's been more than 15 years that we've been associated with various schools. The vision is very clear. The idea came with spreading mental health awareness and sensitization in schools and equipping everybody who's involved in the well-being of young minds that how can they continue to equip themselves with the skills that are required to take care of their mental health, starting from the awareness to understanding what is it that can be done in the mental health space in schools, to talking about life skills training for students. We do pro-social peer moderator program, one of the key initiatives that was started before I even took on this program. And the idea of this program was that how peers can act as a pro-social uh, role model for other peers, and five key essential life skills on which they are trained, and interactive sessions are held each year. We in fact had it in an online series with Dr. Parik this time as well. And then we also do mental health curriculum as one of the key initiatives that we started in 2018. And the idea was, again, we talk so much about physical health in schools and the importance of physical health, but why not talk about the aspect of mental health as well? Because so much is connected to our mental health, whether it is our emotions, whether it is our relationships, your workspace, how you're performing, even the physical health aspect. If your mental health is not okay, it impacts your physical health as well.
Absolutely.
Sometimes these are these aches and pains that we wonder why we are having, and every doctor says, well, nothing organically that I'm able to. You're absolutely fit, yet you're experiencing it because there is something in the form of stress which is impacting your physical health over there. So we have to really understand the importance of mental health and how it is connected to the core of everything. So mental health curriculum, where training of teachers, and then in a very fun learning way for students, how it can be brought into the school system, integrated much well in a much better and a way. And then of course training for parents, educators. So it's a huge range of various initiatives that we do, bullying initiative, multiple layers, multiple things, just to ensure that the ecosystem is somewhere maintained very well and is equipped very well.
Absolutely correct. So, in your journey, have you seen or have you felt like the schools and the teachers are still not ready to accept that the schools have to be or have to convert themselves into an inclusive school, or maybe the teachers who are from an old generation, they have to train themselves, they have to learn. It's still a stigma, it's still a taboo. I know some of the teachers are still not ready to understand. So, do you feel in your journey you have also gone through such issues and such areas of the school where you were not able to make them understand and they were not ready to accept it?
I think it's been a long journey from where the awareness was still the emphasis and the acceptance was still a challenge. But now we are today, we are in a much better space where, along with the awareness, there is a lot of acceptance. And when we talk about schools, I think schools are trying their best to see what they can do to make it into an inclusive space. Of course, it has its own challenges. I
Absolutely.
think when it comes to either the training part or the infrastructure part, there are different areas where more work needs to be done. But to say that in schools the acceptance is less, I would not say that now. I
Okay.
think the aspect of, and again, one has to also look at that when we talk about geographically. Of course, in the urban cities, tier one and tier two, there is more acceptance. You go a little far away in tier three, awareness will
Yes.
be less, so the acceptance will be less.
Absolutely.
But a lot of private schools in metropolitan, urban, tier one, tier two, and even government schools, given the fact that government has brought in so many important initiatives, there is at least the awareness that we need to do something more in the space of life skills and mental well-being for students. So that is certainly there, but it still is a long way to go, given the fact skills training needs to happen, implementation needs to happen. That becomes a challenge. And there are, of course, challenges in the space of also creating the right kind of awareness amongst the parent group as well, because
Yes,
while we are able to cater to the education and the awareness part to teachers and in schools, that is still a segment that requires a lot of work to do, and which is where school needs to take that initiative to have more consistent parent awareness so that they also understand where the school is playing a role in terms of bringing mental health inclusion for every child.
absolutely. So, Mimansa, new parents often struggle. And these parents also struggle for a parenting style, especially the neurodiverse kids. So much of awareness is available right now due to internet also. There are so many influencers who are available who are providing different recommendations, strategies, and everything. So how can we help these parents to maintain this balance effectively? And specifically in the context of if a particular parent has a neurodiverse kid, so how that particular parent and along with the school, how they can at least support their children's mental well-being? Because I understand there is a new concept of having a shadow with the new neurodiverse kids. School are very clear that okay, we are an inclusive school, you need to send a shadow along with your child. So how they can, because there is so much of taboo information, miscommunication, misinformation also, parents are in a certain dilemma, what are they supposed to do and what they are not supposed to do.
I think that's still an area that requires a lot of integrated work. The loopholes are still there. Although I'm not an expert in neurodiversity and working in that area specifically for with children, so
Mm-hmm.
I won't be able to comment too much on that. But to be able to understand the fact that yes, when it comes to divergence in terms of neurodevelopmental aspect, the acceptance for the parent that yes, that is there. The journey starts from there, that one, they need to first begin to be a bit more comfortable with the idea that yes, this is a reality, and that takes a little while, and the kind of support that we can provide to the parents at that point in time, because obviously it's a shock for them. They're not aware of these conditions that are there, and then they recognize that my child was struggling because of this for such a long time, and what I was trying to do was make changes in my own parenting, and try and be a little more harsh sometimes, or maybe look at what the child is not doing right. So awareness in that sense again needs to be there a little more. From there, the acceptance for the parent, because when they recognize that is there, it takes a little while to sort of absorb it. And then a journey in which they are given that support that, we are there. So whether it is a shadow expert that is there, or it is an external expert who's specialized in the area, and the school, all of them need to work together in a very collaborative approach over there, because it's a very difficult journey for both the parent and the child. And there is still there still continues to be stigma when it comes to mental health. We can't say we are stigma free at any given level, no matter whatever the mental health condition is. We are not stigma free still. We still have a lot of stigma that we need to address.
Absolutely. Absolutely. So many working parents use TV or phones to keep their children occupied during meals or other times due to their busy schedules. But they do feel guilty about it and they do talk lot of talks. I'm also being a parent. I also do that sometimes. Having an ADHD kid, doing that journey for 11 years, I also know that screen is not good for him. But sometimes it becomes a havoc for us, and then we are like, okay, do 1 hour of screen, and it can turn to a 2 hour also. But as us parents, and as specifically as school also, because school in today's generation, the new digital schools, what they do is half of the time they are teaching kids through digital screenings and everything. They are going through the chapters, they are going through that digital things. Do you think the technology is somewhere hampering these children, or somewhere hampering people's mental well-being?
Excessive use of anything is harmful for us.
Yeah.
So while technology is here to stay and it will be here for a longer duration, I mean, it's never going to go away. What we need to understand is, what do we ask? I mean, the right question to ask over here would be, what do I do with this access to technology that I have from different sources and mediums because of different usage that it plays in my life? The role
Right.
of that. So let's say for a student, it's about, yes, learning. So the academic aspect becomes one, entertainment, playing, gaming becomes the other, connecting with the friends. Of course, that also happens. Where we need to sort of help them channelize the other aspect of their energy, their mind, is where they don't start using this as a distraction, which is actually there for you and me as well. And which is where we need to also bring about a change. I mean, we need to be
Absolutely.
better role models in that sense.
Right.
So the moment a child starts using this as a distraction, as a means to keep themselves just occupied because they're bored, as a means to also even cope. Because if you talk to a lot of young people, they will say, if I'm stressed, gaming for a few hours, it makes me feel better.
Correct.
Or for, let's say, another young person who says, I don't have friends over there. So this is where I have my friend circle. We play a game together. And so it obviously goes on for hours together. So what do we do with this? That is
Right.
important for us to know.
Correct.
We are not saying that students should not, or children should not be playing. We are not saying children should not be using social media. We are not saying that they should not be accessing it for learning or anything. All of this is going to happen. This has become a part of our lifestyle. But what are the right skills that we can give them? One, in the form of media literacy, for them to filter the information,
Correct.
the right kind of learning and teaching when it comes to the kind of influence it has on us, whether it is our choices, emotions, behaviors, even aggression, increase in aggression that can happen with what we view, and the negative impact it can have because we are making this relative comparison constantly with, the kind of posts and reels we end up seeing. The self-esteem aspect, the likes and the shares don't start to make us question about my own worth and value and liking by the others. That needs to be addressed. If I am using this as a coping, then I need to certainly, as a parent, channelize my students' coping mechanism to physical sport, to art, to music, whatever their interest is. And a lot many times parents feel it challenging that how do we do it? Kids don't want to do it. I say, you start with them,
Yes.
do it along with them.
You have
It's
to.
because they see us also not doing and just sitting at our homes. We come back and we tend to have so many rationals to why we are not doing this. No, there is no excuse for you to. So you also go out, maybe play a sport. Ask them to also time it with their sport. Do that.
Correct. When I am hearing to you, I have a specific example. We I think 2 3 weeks back, when we once went to a vacation at a hotel, my son didn't wanted to leave the iPad. And I was so adamant, no, let's just go somewhere. Chalo, let me just roam here. Chalo, let's go to the swimming pool. It took me 1 hour to convince him. I had to jump inside the pool. Then he saw me, and then he was like, "Okay, I'll go, but I'm not gonna wear the swimming costume. I'll go in my joggers only." And it's fine. You just come in. So it took me almost 1 hour, and after 1 hour, he came inside, and then he was not ready to leave the pool. He was there inside for 3 hours. But definitely, it's a task. I think parents here have to include themselves a lot with their children. They have to do a lot. Till the time I know, I don't start any activity, my son doesn't want to do anything. He's like, I'm sitting, I'm fine.
True.
Yeah. So I think, yeah. So, Mimansa, as a leader in the Fortis School mental health program, how do you ensure that these mental health policies are effectively implemented in schools and are genuinely benefiting children?
I think our aim is to bring it to the school. And I mean, I don't do it alone. I have a huge
I
team of
Yes,
young people who put in a lot of effort, and it only takes a team with a lot of passion and care and commitment to the
absolutely
program to
agree.
bring it to the level that it has become now. We still have a long way to go, but um, I think it's about just having the right intention in place and just continuing to put your efforts. There was a time where schools would question, why are you doing it without any cost, and why would you do it? There has to be some underlying motive. And to go out there in the field and hear that, and from those where we've reached to a place where they know that yes, we do it. We do it because we want this to be there in schools, and we want people, who are connected with the schools, to have the right information, the right knowledge, and whatever support that we can give them as a part of the school mental health program.
Wow. So doing all those things, managing teams and everything, how is Mimansa ensuring her mental health is absolutely fine?
I do certainly unwind after my day gets over. I put my phone aside on the flight mode after evening. I do listen to some music in the evening. I do some physical exercise every day. That is a part of my schedule. It took me a little while to understand that it's very important, because, like anybody else, I was also neglecting it. So, yes, finally, it has come into a very consistent level. I'm happy and glad about this. Spending time with family a must. Having conversations with my daughter is a must before sleep, because that's the quality time that I get with her. With everybody busy schedules, school, then action packed day with activities, and then finally coming down to dinner and other things. But I think the key is, um, the 9 to 5 thing is not existent any longer for anybody.
Right.
So it's not there for even me as well. It's not there for any profession. I mean, we used to call one particular profession that, this is 9 to 5, but
No,
no
it's
profession is
not.
9 to 5 in today's time.
Right.
It's about how are we able to create, which I call my pockets of mindfulness or pockets of me time in between my work in the daytime, that I can give to myself. So if I can just, after this, I'm going to sit back for just 5-10 minutes and enjoy my cup of coffee and then go to the next patient. This is what I'm going to do. So that is going to be my 10 minutes of me time. Then do a couple of things. Then again a break of just 5 to 10 minutes. If I'm in the hospital, then the peers and the colleagues. If you have
They
a good
don't. Right.
relationship, it becomes a joyful place to
I
be
know.
in. So you spend time with them, you have lunch with them, you do something else with them. So that becomes, so those short breaks is something that is very important for us to have.
Absolutely. Absolutely. I agree. So, with that, thank you, Mimansa. Thank you so much for coming and having this conversation with us. We literally enjoyed, and I hope our subscribers have also enjoyed, and they would love the episode. So, thank you so much for coming, dear.
Thank you. Pleasure.
Okay.
Thank you.